who cannot enter today will have an access through our YouTube channel. Okay? Sige. So, as what I have shared to you over your GC, no? Uh, our topic for today is chapter 3, which is all about introduction to nutrition assessment. Okay. So, before we will have your discussion on the macronutrients, which will start tomorrow, no? So, there is a nutrition assessment. This is actually just a short topic because, again, this is just introductory. You will actually have a separate subject, no, about nutrition assessment next semester. Okay, because this is very important. This is one of the steps of the nutrition care process. So nutrition care process, we will define that later, no, but uh, that is a very important procedure, no, that registered nutritionist dietitians employ, not just in healthcare setting but also in the community setting as well. Okay, so kumbaga, mauna nga to ang standard procedure, no. Okay, nutrition care process. If the other professionals have, for example, for nurses, they have the nursing care process. The medical doctors, they have the medical care process. So sa ato na atay nutrition care process. Okay, so we will define that later, no. Okay, but I just want to make sure, no, if my screen is now visible to you. Makit-an ra ba? Hello? Makit-an ra?
Nakita na sir.
Okay, sige. Ah, okay. So good naman to, no, ang recording. Okay. Sige. Uh so this is the basic premise, no. A person's nutritional status or literature is a good indicator of one's state of health. Okay. You know this already. We were able to discuss this one. Okay. In order to be healthy, no, one of the aspects that a person must accomplish or must attain is good or optimal nutritional status, because most of the times, um, if you have unbalanced homeostasis, okay, so you know that homeostasis is, the balance of physiological processes in the body. If there is something wrong with that balance, then that would ultimately result to disease. Okay, and one of the factors leading to an imbalance of homeostasis, um, or onset of disease, is poor nutritional status. Okay, so the prerequisite for health, no, is actually one of the prerequisites is optimal nutritional status. So how do we evaluate one's nutriture? So that is done through nutrition assessment. Okay, so uh that's why this is very important, no, because in order for us to be able to identify, what are the nutritional problems of our patient, or of our client, or of a certain community, then we have to do this procedure, nutritional assessment. Okay, so again, to define nutriture, this is the condition of the body that results from the utilization of essential nutrients made available from his or her daily diet. So, this is the end result of your intake of foods, okay, and other factors as well, as presented in this figure. Okay, in order to attain this balance, which is called optimal nutritional status, you have to have balanced nutrient requirements and nutrient intake and absorption. Okay, so each of these sides, no, has its own sub factors. So for example, here in nutrient intake and absorption, um na food intake, no, so what are the factors that could affect one's food intake? Okay, because food intake would ultimately affect nutritional status. Okay, uh na-discuss sa sad nato ni sa chapter 1, no, we have those primary and secondary factors. When you say primary factors, those are the external factors, no? And then the secondary factors, which are the internal factors. So in here, in the food intake side, no, we have both the primary and secondary factors here. So primary factors are um, culture, religion, access, economy. Okay, so all of these could either reduce or increase one's food intake that could, affect ultimately their nutritional status. We also have here the what's this? The secondary factors or the internal factors. Preferences, experiences, knowledge, beliefs, attitudes, emotions. Okay? And then we also have absorption. Okay? Because it doesn't mean that after you consume, no, a particular food, it doesn't mean that all of the nutrients that are there would be ultimately absorbed. No, there might be obstacles, no, in absorbing those nutrients. One of them is decreased bioavailability. Okay, so each of the nutrients, guys, actually has their own bioavailability. Some of the nutrients are more bioavailable than others innately. For example, guys, we have iron and calcium. Those are the nutrients that are generally poorly absorbed. For calcium, we can only absorb, no, like up to 40% if okay ato ang nutritional status, or if okay ang ato ang health status. Okay, because that would also that the disease state, no, would also affect our absorption, such that if deficient ta ani nga mga nutrients, then our GI tract would tend to absorb more nutrients to compensate for the deficiency. Okay, but that's a factor actually under here in nutrient requirements, no. But yeah, um less ang bioavailability sa calcium and iron, no, compared to, for example, iodine. Our absorption rate for iodine uh, can be up to 100%. So that means kung pila ang iodine nga naa sa food, halos tanan yun, no, ma-absorb sa atong lawas, whereas kaning calcium 40% lang, di ba? For example, if uh, kaning calcium nga naa sa milk, sa FCT, for example, ang naa sa FCT is 300. Not all of the 300 of that calcium, no, can be absorbed. um 40% lang usually ang atong ma-absorb ana. Okay, mas mubo ang absorption rate for iron. Okay, 5 to 10%, no? Okay? Magdepend pa gyud na kung unsa nga klase nga iron. Okay? We have the heme and non-heme iron. Okay? So, heme iron are those dietary iron that can be found from animal-based food products. Okay? The non-heme iron mao nang makita nato sa plants. Okay? So, plant sources of iron are said to be of lower bioavailability compared to animal-based iron. Okay? Yeah. Okay? So, that's why mas taas ang absorption rate nato, no, kung ang iron magikan sa animal-based foods. Okay? So, uh, absorption rate is one of the factors of bioavailability. Okay? Kung mas gamay ang absorption rate nato, mas mubo ang bioavailability. Okay? So, um, we will discuss more of this topic, no, when we reach nutritional biochemistry yun, no. But that's an example of how we must understand nutrients bioavailability. Okay? We also have GI function. Uh, of course, if someone has compromised GI function, then that would lead to decreased absorption. Okay? For example, if a person is suffering from diarrhea, usually mga bata, no, mga infant, mga young children, if they do experience a lot of diarrheal episodes, then that would mean that they can just absorb less of the nutrients, no. Okay? Saan man nila pag-absorb sa nutrients if magsige sila diarrhea. Okay? So that's why in the hospital food, guys, if we are doing nutrition assessment, we also want to determine the extent of their GI function, because that means if ang patient no ga-experience og vomiting, okay, magsakita ilahang tiyan, di pa na sila ganahan magkaon. So kung di sila ganahan magkaon, so unsaon nila pagkuha sa nutrients, and that would ultimately result to malnutrition. Okay? So that's why very important ang GI function, guys. Especially in nutrition assessment. We also have disease. Okay, kani. Um Usually sa hospital, guys, ang mga patients gyud kay di ganahan magkaon. Okay? That's one of the effects of their disease. Inflammation, actually the underlying cause of anorexia. What do you mean by anorexia? Anorexia is decreased food intake, okay, due to decreased appetite. Okay, di sila ganahan magkaon, wala sila yung appetite. Why? What's causing that? The cause is inflammation. Okay, that's one of the systemic effects of inflammation, and usually kanang mga diseases that uh, kanang mga diseases nga mauna tungod ana kay na-hospitalize sila, usually naay inflammation sa ilang pathophysiology. For example, we have diabetes, okay? Although ang acute effects sa diabetes kay um, polyphagia, but later on no di na sila ganahan kayo magkaon, leading to weight loss. Okay? Tungod na siya sa inflammation nga gaka-experience nila. Okay? Cancer. Yeah, that's a classic example of inflammation-induced anorexia. Okay? Ano di man gyud ganahan magkaon ng mga cancer patients tungod sa inflammation. Okay? So, um, yeah. So, that's why if naay inflammatory reaction ang lawas, no, uh, anorexia ang kuanan ang cause. Kung hilantan ta, 'di ba? Di ta ganahan magkaon if we do not if we feel sick tungod kay gihilantan ta, di ta ganahan magkaon tungod na siya sa inflammation. Okay? Stress, medications, microbiome. Kaning medications pod, there are certain medications that would affect the absorption of nutrients, no? For example, tetracycline drugs. Tetracycline is a class of antibiotics, no? And if idungan nimo ang tetracycline with calcium, sige, unsa man nga mga foods ang taas og calcium? Milk, di ba? So if idungan nimo ang milk consumption and tetracycline sa may mahitabo, dili ma-absorb ang calcium, and dili sad ma-absorb ang tetracycline, because tetracycline would attach, no, with the calcium ions, resulting to insoluble metabolites. Okay, so both of the tetracycline and calcium cannot be absorbed anymore. So dili lang ang nutrient ang maapektuhan, but also the therapeutic efficacy. So mao nang dili maulian, no, ang patient sa infection tungod kay gidungan di ay ang milk with tetracycline. Okay? So kana, and there are a lot of other examples, no, which we will tackle when we reach medical nutrition therapy. Okay? Microbiome. Okay? Um as what I have discussed last time, our microbiota in the large intestines also give us additional amounts of nutrients like biotin, thiamine, and vitamin B12. Okay? So, yeah. So, all of these factors can affect one's nutrient intake and absorption. On the other side of the balance, we have the nutrient requirements. We have medical utilization, life cycle, stress, body maintenance, and well-being. Of course, each of these factors can affect nutrient requirements in one way or another. For example, mag-cite lang tag isa, no, sa kada factor. For example, for medical utilization, kato, no, gibalik naman diri sa absorption. The presence of infection can usually decrease the absorption of nutrients, okay? And can cause anorexia, leading to decreased food intake, okay? Life cycle factors, we have growth and development. For example, during pregnancy, pregnant people do absorb more nutrients than non-pregnant individuals, okay? Because they need that for the growth of the fetus, no, in the womb, okay? So usually kanang mga burus, no, increased ilang absorption sa nutrients, okay? Kanang calcium dili na mahimong 40%, they can absorb as much as 80%, no. So mo increase ang bioavailability sa nutrients due to increased nutrient needs, okay? We also have stress, okay? The same ni siya sa presence of disease, no, na explain ganina. And body maintenance and well-being. We have age, gender. Okay, for example, older people tend to uh, older people need less calories, no, compared to younger people. That's why uh ma-notice niyo sa PDRI, no, ang nutrient requirements sa older people are lower, no, than the younger generation, okay? That's why kinahanglan, no, i-control ang caloric intake sa mga elderly people, okay? Mao po na nga prone to obesity, prone to overnutrition ang mga older people if dili nila i-control ang ilahang diet. Okay? Tungod na siya sa slowed metabolism, no? Slowed metabolic rate. So, dapat dili na daghan kaayo, okay, ang food intake. Next is gender. Okay, of course, males do need more amounts of nutrients than females, no? Okay? Of course, there are cases, no, nga exception siya, okay? We also have height, weight. Generally, the taller you are, the more amount of nutrients you will need. Okay. Activity level. Of course, athletes and those who are engaging with intense physical activity need more calories, need more energy, and of course need more of the micronutrients, okay, to support their metabolism. Okay. Genetics. This is where nutrigenomics comes in handy, no? For example, we have uh, a nutrigenomics. Okay, that's actually different from nutrigenetics. Nutrigenomics is the effect of diet to your genetic makeup, while nutrigenetics is the effect of your genetic makeup to your diet and nutrition. Okay? Sige, mag-cite tag examples sa um, nutrigenetics. So, you know that there are people who are lactose intolerant, no? And it's because of their genetic makeup, because their genes do not create a lot of lactase, which would reduce their capacity to digest uh, lactose containing foods like milk. Okay, so that's why if someone has lactose intolerance, no, um, we need to adjust their diet by restricting dairy products. So mulahi ang ilahang diet tungod sa ilahang genetic makeup. So that's an example of how genetics can affect one's nutrition and vice versa. Okay? There are also um, other examples so that we can cite here. Um, for example, the consumption, no, of foods that are low in methylating substances, like we have B9, B12, choline. Okay? Katumanggod, kanamanggod sila nga mga nutrients, or of course we will discuss that, no, when we reach the vitamins nga part. But one of their functions is to donate methyl group. Okay? Kinahanglan man gud ng methyl groups para ma-transform ang um, mga precursors no to metabolites that are useful in the body. Say for example, the production of S-adenosyl methionine, which is needed in brain function. It is also needed in red blood cell production. Okay? So, therefore, if kulang ka ato nga mga nutrients, kato B12, B9, and choline, then S-adenosyl methionine would not be produced and that would affect one's brain function. Okay? So, that's why you need more of those nutrients, no? If you are genetically predisposed to um, diseases that could lead to hypomethylation. Okay? So, uh, kana siya, kani sila nga mga factors, no, that could, make this imbalance, no, and that could, lead to undernutrition or overnutrition. But all we have to do is to balance all of these factors, and that could lead to optimal nutritional status. Okay, so since we know that these factors could affect nutritional status, then we can actually include this in our nutrition assessment. Because if there is something wrong with these factors, then we can suspect no nga mao na ang cause nga nung kani siya nga patient or kani siya nga client dili maayo yang nutritional status. Okay? Ah yeah, ato balikan ra nako ni later, no, kung mahuman na tag-discuss aning four nga parts sa or methods sa nutrition assessment. Sige. So later na lang ni balikan lang nato ni, no, kay um para mas masabtan ninyo ni kung ma-explain nako tong four methods of nutrition assessment. Okay. Diri sa ta sa nutrition screening. So, nutrition screening must always be done before nutritional assessment. So, this is defined as the process of identifying characteristics known to be associated with nutritional problems. Okay? So, nutrition screening is actually always done, no, before nutrition assessment. Okay? Before ta mag full-blown nutrition assessment, dapat na atay screening. Okay? Because nutrition screening is the first step to be undertaken in order to know whether or not there is a risk of having serious nutritional problems in a person. This is especially important in the hospital setting because we have, especially sa mga tertiary hospitals, they cater a lot of patients per day. Sa mga dagko yun yung hospital, no, pwede mo abot 1,000 patients per day. Okay? But for example, sa Chongwa or sa SPMC, usually mga around 500 to 600 patients per day lang ginakater. And usually limited lang ang manpower, limited lang ang mga R&Ds nga employed. So to be able to prioritize those patients who need immediate uh, nutrition intervention, then nutrition screening must be done first. Okay? Because ang result man gud aning screening is ma-identify nato, no, kinsa tong patient ang mas taas og risk for malnutrition. Because kung mas taas sila risk sa malnutrition, then mao to sila atong i-prioritize first. Okay? They must be dealt with within 24 hours. Katong mga dili kaayo at risk for malnutrition, they can uh, they can be given nutrition intervention within 48 to 72 hours. But katong mga serious na ang nutritional problems, then they must be dealt with, no, within 24 hours. Okay? So, mao nang results sa nutrition screening. Okay? Ma-prioritize na to ang patients ba? So, that would, you know, cater those patients who need immediate nutrition care. Okay? So, yeah. Again, this must be done before nutrition assessment. Okay? So usually kanino ang ginagamit natong nga form kaning this is recommended by the Department of Health, okay? Um, so unsa man ang instruction diri? Mark each box appropriate to the patient if the patient has at least one. So a patient must only need like one of the factors here check, uh, so that they will be referred to the R&D for medical nutrition therapy. But actually, guys, the one healthcare professional that does the nutrition screening is the nurse. Okay? Si nurse ang mag-screening sa patient actually. Okay? Um, Kay dali raman ni siya, mag-check raman sila kung unsay existing sa patient. For example, if ang patient upon admission na siya DM, then insigida na nga i-refer siya for for medical nutrition therapy by the R&D. Okay? So, isa ra gyud ang need para ma-prioritize siya. Okay? So, that's why ang naa diri no signature over printed name of the nurse kay si nurse manggud ang mo fill out ani. Okay? For example, if walay check, okay, walay check diri. So therefore, dili siya i-prioritize within that day. But if admitted yapon siya after 3 days, then i-rescreen dapat siya balik. Okay? Kay basig na anay na develop ng mga symptoms and then dito pa siya ma-prioritize. Okay? So naay form for adults na asid sa PDA no. Okay? Yeah. So if according to the result of the screening no, i-prioritize sapat nato ang patient kay at risk siya, severe risk for malnutrition, then that's the time nga i-refer siya sa R&D for full-blown nutrition assessment. So again, nutrition assessment is the way to evaluate one's nutrition or the extent or level of nourishment. It is also done to identify existing or potential nutrition problems to exist. Okay. Um, some say that we are much better than the doctors no in this aspect. Why? Because many diseases, ang root cause no is poor nutrition. For example, we have diabetes. Diabetes is in itself a nutritional disorder because diabetes would usually result no from a diet that is rich in sugar and that is rich in saturated fat. Okay, and a diet that is over in calories, no. Okay, so that's why lifestyle disease ang diabetes, no? It's a nutritional disease. Okay? And diabetes is one of the uh, top killers, no, out there. Okay? We also have cancer. Many types of cancers, no, are precipitated by poor nutrition. For example, a diet that is low in fruits and vegetables has been associated with a lot of cancers, including stomach cancer, colorectal cancer, no? Okay? Then maubaya na usually ang mga forms of cancer no nga naa diri sa Philippines tungod sa low fruits and vegetable or low fiber diet. Okay? We also have myocardial infarction, which is heart attack. We also have cerebrovascular accident, which is stroke. Okay? Ang usually ang root cause ana nga mga diseases no kay um diet that is rich in saturated fat. Okay? That would lead to atherosclerosis or formation of plaques no sa arteries that can lead to heart attack. Okay? And stroke if naay nag-clog diha dapit nga arteries no padulong sa or veins or blood vessels nga padulong sa brain that causes stroke. Okay? And tungod na siya usually sa atherosclerotic plaque that is precipitated by again a faulty type of diet. Okay, so um, we actually with the help of nutrition assessment, no, we actually identify the nutritional problems which are the precursors of those diseases. So before those diseases can become severe, no, we can actually like prevent them from happening through detecting them earlier. Okay, so kung ma-detect nato nga dili maayo ilahang diet, okay, so we could actually prevent in the first place those diseases from occurring in the patient. And you know that prevention is better than cure. So that's why in that aspect, we are better than the doctors, no, because we can, you know, detect the early signs of those disease. And one of the early signs is poor nutrition. Okay. And that's one of the goals of nutrition assessment, to determine what's wrong with their nutritional status, to determine the problems that they encounter, no, when it comes to their nutritional status. Okay? And maog yun na nga to ang trabaho, guys, especially kung sa hospital ta mangita gyud tag nutrition problem sa patient, because naagyo na sila problema sa ilahang nutritional status. Okay? And what we do first is nutrition assessment. Okay? If you are employed in a community, mangita gyapon mo problema. Okay? Pero in a population level na, or in a community level na. Okay? So, yeah. Nutrition assessment of a community. Okay, talking about community nutrition, no? Is the appraisal of the magnitude and geographical distribution of its nutrition problems as affected directly or indirectly by available information on determinant ecological factors. So, of course, naatay mga subjects later on, no, about sa community. So, mag-assess gyapon mo sa tibuok community. Ang difference manggod sa community and hospital is ang community, you treat what the whole community as one patient, but sa hospital individual gyud na sila nimo i-treat, no. Okay, so yeah, mao nang difference sa community and hospital. We also have nutrition surveillance. So this is carried out by regular or periodic evaluation of measurements that can be used to indicate present as well as future changes in literature. So, uh, if a series of nutrition assessment is needed, no, in a certain community to monitor, no, changes in the literature of the community, then that's surveillance. Okay? Usually kani ginagamit ni siya sa community nga setting. Okay? Medical nutrition therapy, kani ginagamit niya siya sa hospital. This is a specific nutrition service and procedure used to treat an illness, injury, or condition. So, medical nutrition therapy includes the employment of the nutrition care process. And part of the nutrition care process is nutrition assessment. So, it involves an in-depth nutrition assessment of the patient, nutrition diagnosis, nutrition intervention, which includes diet therapy, counseling or use of specialized nutrition supplements, and nutrition monitoring and evaluation. Okay, so generally, this is what we do in the hospital. We do MNT, and one of the parts of the MNT is nutrition assessment. Because how are we going to treat a nutritional disorder if wala ta kabalo sa problem in the first place? And we know that the purpose of nutrition assessment is to identify the problem. Okay? So inana dapat, ha? So assessment sa ayha nato ayha ta makabalo unsay dapat ang ihatag sa patient para ma-treat ang problem. Okay? And yeah, this is what I am talking about, the NCP. So this is a systematic method that dietetics and nutrition professionals use to provide nutrition care. Okay? So, para mas dali na to ma-memorize, no, we have this acronym ADIME. ADIME stands for Assessment, Diagnosis, Intervention, Monitoring, and Evaluation. Okay? These are also called the four steps of NCP. Step siya kay systematic man siya, meaning step by step nga procedure. So therefore naa gyud dapat mauna before the other. And ang pinakauna nga himuon is assessment. Because again, saan man nato pag-diagnose kung wala ta nagdug assessment. Okay? So that's why una yun ang assessment. Then ayha ang diagnosis. So ang diagnosis diri nato kumbaga nganlan no kung unsa ang nutritional disorder or nutritional disease or nutritional problem sa patient. Okay? An example of a nutrition diagnosis is obesity. Okay? But para makahimo tag formal nga diagnosis no na ay format nga gina follow which is called the PES format. So we have the problem, etiology, signs and symptoms. So kumbaga yung nutrition diagnosis naka-structure ana nga format. So example, obesity related to excessive calorie intake and physical inactivity as evidenced by BMI of 30.30 kilograms meter squared and report of sedentary lifestyle. Okay, that's an example of nutrition diagnosis. Okay? Formal siya, structured siya according to the PES format. So, you will be able to learn about constructing, about how to formally construct a diagnosis next semester, I think. Kay next semester inyong NCP. Naapod mo yung subject nga, whole yun nga subject nga separate, which is next semester, which is just all about NCP. Okay, so dito ninyo mahibawan unsaon pag-construct sa diagnosis. Okay? If na-identify na nato ang problem, then na-diagnose na nato ang problem, then unsay next? Intervention. So diri na nato planuhon no unsay ihatag nato sa patient para ma-solve ang problems nga na-diagnose. Okay? So diri ta maghimo og strategies. And after planning the strategies to treat the problem, mag-implement ta. So, ang implementation, naagyapon siya sa intervention nga part. Okay? Monitoring and evaluation, this is what we do in order to monitor the progress or the effectivity of the intervention that we implemented. Very important ni kay dili naman ta basta-basta nga mag-implement sa atong actions and then wa ta kabalo if naa ba siya effect sa patient, if those intervention strategies are solving the problem in the first place. So para makabalo ta, dapat maghimo ta ning monitoring and evaluation. Okay? So yeah. Okay, so this is what I told you about no ganina, the four general methods of nutrition assessment. So, unsaon nato pag assess sa patient? We have the or Anthropometric Assessment, the Biochemical Assessment, the Clinical Assessment, and the Dietary Assessment. Actually, na-introduce na ako di ay ni siya no, sa chapter 1. And this is the ABCDs of nutrition assessment. So, dali ra siya ma-remember kay ABCD ra gyud siya. A. Anthro. B. Biochemical. C. Clinical. D. Dietary. Okay? So, ato ni siya hisgutan one by one. Although, dili kayo siya in-depth kay introduction raman ni. But, this would give you an idea, no? On how to better appreciate our role no in the hospital setting as well as in the community setting. So first, we have the anthropometric assessment. So this is the measurement of the physical dimensions and body composition of man. So duha aside from physical dimensions na atay body composition. So we have these basic measurements that are involved in anthropometric assessment. We have height or length. Okay, we have weight, the waist circumference, waist shape ratio, BMI, etc. So examples lang ni. Daghan pa kaayog mga anthropometric measurements na, but these are the basic measurements, okay, that we do in anthropometric assessment. Height is actually a chronic result of nutritional status, while weight is an acute result. Okay, when you say chronic, long term. When you say acute, short term. So therefore, the result of long-term nutritional status is height. Okay? So kaning height mo nang result no sa long term na gyud nimo nga level of nourishment. Okay? While weight, this can be affected no by acute changes in the nutritional status. Okay? So, mao ni ang examples guys sa body dimensions no. Okay? Body dimensions, we have the height, weight, of course, magamit ang timbangan na nasa weight. Sa nutrition assessment po ninyong subject, no, you will be able to do properly the uh, taking of the height of the patient, no. Okay? Kay very important man ang procedure guys in order to minimize error in measurements. So sa assessment ninyo may bawaan. Okay, this is the height standing uh, length no. While ang length is maunang sa infant. Okay? So kani siya mao infantometer no. Okay? We also have measurements of the body circumferences. So we have the weight and hips. Okay? So dimensions kaya po ni sa body. Okay. So what are the body composition? So body composition is actually evaluated no by these instruments. We have the bioimpedance. Okay. Kani bioimpedance siya no. And we also have DEXA scan. Okay. Dual energy X-ray, absorptiometry. Okay. Or DEXA scan. Okay. Advanced na ni nga anthropometric measurements and wala tay equipment ani diri but naatay simple bioimpedance analyzer naata diri sa building no. So I'm looking forward for you no to be able to use that equipment. So what do these machines measure? The amount of fat in the body, the amount of water in the body, the amount of muscle mass in the body. Okay, so lahi siya sa dimensions. Kaya ang dimensions kay mga sukat raman sa lawas. Kani nga mga equipment kay composition gid mismo kung unsay naa sa sulod sa lawas. Okay? So kani actually ang mao ni siya ang body composition, mao ni ang body compartments. We have the fat-free mass, the body fat mass, and then yeah, kani two compartments, kani three compartments, kani ang four compartments. So kumbaga mao ning three different kinds of models na of the body, the two compartment model, the three compartment model, and the four compartment model. So dirita sa two compartment model, um, for body fat mass, okay, usually mao lang ni ka compare nimo sa fat free mass no mas dako ang fat free mass. Okay? And fat free mass would include the lean tissue mass and then the bone. And then the lean tissue mass is further divided into two, the total body water and then the protein. Okay? So when you say FFM, that's fat-free mass, that would include the protein, which is found in the muscles, which is found in the flesh. So kana sa muscles na to ng protein, no. Then ikaduha nga part sa fat-free mass is total body water, and then ang ikatulo is the bones. Okay? What about the body fat mass? Mauning makita nato sa adipose tissues nato. Okay? And mao po natong makitaan sa mga visceral organs. Okay? So, in that aspect, we can classify the body fat mass into two. We have the essential fats and then the storage fats. The essential fats are those visceral fats, no, that that surround the delicate body organs like the liver na amang good na yung mga fat diha nga ga-surround sa ato ang organs for cushion no for protection. Okay, so kana siya importante gyud na nga dili dapat na siya mahilis no. So that's are the essential fat. What about the storage fat? Kining storage fat mao ning pwede nato kuhaan og energy if for example magkulang tag energy intake no. So pwede nato na break down no for energy. Okay? So kanang storage fat of course makita nato sa mga subcutaneous fat nato like kanang naa sa tong belly, okay, kanang mga naa sa tong arms. So diha ang subcutaneous fat. So pwede nato nakuhaan if again uh, mag-need ta og additional energy. Okay? So these compartments of the body are evaluated no by Anthropometric Assessment. Okay, mao man na silang body composition. Okay, and then these measurements are compared to standards. Measurements of height and weight must be repeated on an individual to note the degree of change in nutriture over time. Okay. Uh for example, ani is BMI. Okay. I don't know if you have already computed your BMI, but that's just height over weight over height in meters squared. Okay? So usually ang BMI nato no mag-range from 18 to 30. Okay, and natay classification ana para may buan nato if overweight ka or if normal ka or if underweight ka or even obese. Okay? So ang normal is 18.5 to 24.99. Okay? So usually kato nga mga measurements are compared to those standards. Okay? So, for example, ang measurement nimo sa BMI is 26 and i-compare nato na sa standard, ang standard sa overweight is 25 to 29.99. So 26 man, so nag-fall siya dito. So therefore overweight ka if inana imong measurement. Okay? Um yeah. So usually sa mga bata guys no, ang ginagamit nga anthropometric measurements kay height and weight. Okay? And they are compared to the standard set by the WHO na amang good mga charts ana nga i-compare nato para may baw-an nato if normal ba ang ilang height for age, normal ba ilahang weight para sa ilang edad, kung normal ba ang ilahang BMI for age na ay mga inana no. Okay? Usually those basic measurements, height and weight, are compared to their age to see if ang ilang height and weight appropriate ba sa ilang edad. Okay? Usually maunang sa PDA nga anthropometric assessment. Whereas sa adults, 19 pataas, usually BMI no ang ginagamit. Okay. And in the hospitals guys, mao ni atong usually nga gina-compute no percent weight loss, especially sa mga patients nga gaka-experience og weight loss tungod sa ilang disease like cancer or cardiac failure. Usually manggod mag-experience sila og weight loss. So ato ni siya i-compute para makabaluta if severe ba ang weight loss or not, because that means if severe ilang weight loss then that would need more intense no nutrition intervention. Okay. So how do we do the computation for percent weight loss? We have usual weight minus present weight divided by usual weight times 100. Okay. So weight loss of 5% in a period of 30 days is considered a severe risk factor for malnutrition. Okay. So try to uh, try to practice this formula no. Okay. For example, ang usual weight is 60 and then ang present nga weight sa patient is 52. So that's 60 minus 52 divided by 62 times 100. So if manubra gani nag 5%, then severe na ang risk factor for malnutrition. Okay? We also have these other anthropometric assessment measures. Okay? Aside atong mga basic measurements, we also have stature from total arm length. Okay? So, pwede actually i-measure ang arm length, no? Para ma-predict na to ang height sa patient. Usually, it is done in the hospital. For example, dili makatindog ang pasyente, the only way to estimate their height is to measure their arm length. Naada yung tay gamiton anang formula para ma-predict na sa iyang height. So, that's TAL or stature from total arm length. We also have mid upper arm circumference or MUAC. So, ginagamit po ni siya para ma-identify na to especially mga children, no? Kani sa pedya ni siya ginagamit para ma-determine na to unsa or kinsa to nga mga bata ang at risk or naanay malnutrition. Gina-measure ang mid upper arm, no? Okay? And naay values to determine kung normal ba or severe na ba or mild ang malnutrition. We also have body frame size, triceps skin fold thickness. Kaning triceps skin fold thickness, this is just a simple measurement, no, to determine or to estimate the amount of body fat. Okay? Gagamit ta ani og caliper. So, naatay equipment ani no for triceps skin fold. So, you will be able to use this no sa inyong assessment nga subject next semester. Measurements of body composition using bioimpedance analysis and DEXA scan. Okay, katong ako ang gipakita ganina. Okay? Para ma-estimate nato kung pila ang body fat sa patient. Okay? Kani mas accurate yun ni of course kay gagamit naman tag mga high-end nga equipment compared sa triceps skin fold, no. Kaning triceps skin fold ginagamit rin ni siya sa screening. Okay? And maybe sa assessment na sa community. But ang gold standard sa hospital kay dapat DEXA gyud. Okay? Mas reliable ang DEXA sa BIA. But okay ra gyapon gamiton ang BIA if maura na ang available because kaning DEXA scan mahal ni siya, no. Um kanang mga athletes pod, okay, kung sa sports nutrition, if you want to determine the accurately, no, the composition kung pila ba ang muscle mass, pila ang fat mass sa imong athlete, then ang pinaka-accurate is DEXA scan. Okay? And adjustments for amputation. Okay? So, what are the advantages and disadvantages of anthropometric assessment? So, advantages: inexpensive, easily obtained, and non-invasive. Okay? Can say something about the long-term nutriture and does not require highly skilled operation. Okay? Kaning non-invasive kay dili man gud ta mag-draw out og blood. When you say invasive, kanang usually surgery, okay? Kanang kuan yun, no, mag-invade yun sa mga body tissues like through surgical means or mag-draw out og blood. Sa antro kay measure raman nimo ang dimensions, magtimbang raman, di ba? Kanang mga basic nga measurements. So that's why they are non-invasive. Okay? But the disadvantages include not an acute indicator. So that means your anthropometric measurements would not say something, no, about the recent changes in nutritional status. So, for example, if you want to know, no, if naay changes sa iyang diet from the past week, then dili na to magamit ang antro. Kay kaning antro long term ang good siya. Okay? Siguro katong iyang level of nourishment from the past month or from the past few months kana hinuon ma-measure na to na through antro, but kung last week lang then di na siya ma-detect sa antro. Okay? And this is more prone to human error, especially if di ka kabalo unsaon pagsukat sa height yun nga sakto. Okay? Ah, if error no ang pag-read nimo sa measurement, for example sa timbangan, okay? So that's why it's more prone to human error. And this is not used to analyze overlapping deficiency states. Antro can only detect energy as well as macronutrient malnutrition. But, hello, excuse me. Ano sir? And it cannot detect micronutrient deficiencies. So, ang iyahang ma-detect lang is uh, your status of energy intake. Okay, of course, if gamay imuhang energy intake, then kung long term na, then underweight, no, that would result to underweight, magniwanga ka, di ba? Kung sobra-sobra pod imuhang caloric intake for a long time, then that would result to obesity, and mao nang ma-detect sa antro kay weight is part of the basic measurements of antro, but it cannot detect like iron deficiency, no. We need to use other methods of assessment para ma-detect na to ang, for example, iron deficiency or iodine deficiency. Yeah. And those are the measurements that we are going to tackle next. Okay. Biochemical assessment. Okay. But yeah, mauning mga other examples no sa antro para ma-detect nato ang protein status. So, mid-arm muscle circumference, grip strength, plasma proteins. Kaning grip strength, hand grip na siya actually. And there are a lot of studies indicating that if dili kayo maayo imong grip strength, if low ang imong grip strength, that would mean that you are deficient of protein. Okay? Because protein is needed by the muscles, no, and that means if low imong grip strength, then that would say something about your protein status. Kulang siguro no ang imong protein status. Okay? Yes, naabay questions. Okay. Okay. Sige. Ah, for fat stores, kato ingon nako triceps skin fold, BMI, okay? Ah, mao lagi na nga ma-classify na to ang individual as overweight kung magamit tag BMI, because the BMI actually measures the fat stores, okay? But if we want to be more accurate, then we can employ DEXA scan or bioimpedance analysis, or even MR or CT scan, diba? Or even computed tomography scan, okay, or CT scan. We also have ultrasound, waist circumference, and waist to height. Okay? For body water, pwede na to magamit ang BIAS. What I said kanina, weight change and abdominal girth. Okay? So, please note this kanang kuan measurements and if unsa ang ilang i-measure. Okay, next is biochemical assessment. So, this involves measurement of the level or concentration of substances and nutrients in bodily fluids such as blood, urine, and functional level of tissues and or enzymes. So, these biochemical measurements are called lab tests. So, the actual lab test results are compared to the standards. Okay? So, diri na mosulod si laboratory readings nimo, no, laboratory measurements nimo sa biochemical assessment. Okay? We have two general types of biochemical assessment. We have static and functional. So, for static measurement, we analyze no the results of the basic metabolic panel, and the basic metabolic panel includes the blood glucose, blood sodium chloride, potassium, total calcium, bond, and CREA. Okay. We also have comprehensive. So this is much wider no than the BMP, because the CMP includes not just the BMP but also phosphorus, albumin, cholesterol, and blood triglycerides. Okay, so under the static measurement, no, we merely measure the amounts of these substances in the blood. Okay, through BMP and CMP. Aside from this, naapod tay CBC. Okay, mo siya usually no ang draw out sa hospital sa mga medtech no, CBC, complete blood count. Okay? We also have plasma serum vitamin and mineral levels. So here, gina-measure nato no ang amount of vitamins nga naa sa atong blood, because if mubo ang ato ang for example vitamin A, serum vitamin A, that means pwede ta mag-suffer no og vitamin A deficiency. Okay? So if mubo ang mga levels nato sa nutrients sa blood, then that would say something no nga na ay naatay mga deficiencies atong mga nutrients. Okay. Aside sa blood, pwede pud ta mag-test no through stools, okay, and through the urine, which is called the urinalysis. Okay. Sa stool testing, ang relevance ani sa nutrition assessment no is, for example, if naatay makitaan nga mga uh, egg sa parasites, then that would mean nga na ay parasites ang intestine sa patient, and parasitism is one of the causes of malnutrition. Okay? Urinalysis, kung ano siya, no, very important ni siya. Usually is kung diabetic atong patient, no? Because that would say something about the extent no of the damage that the damage in the kidneys, no? Like if taas ang level sa CREA or taas ang level sa um, glucose. Okay? Glucosuria is the presence of glucose in the urine, and that would indicate nga ang patient siguro kay pasig diabetic na. Okay? Kay normally dili man na makita ng glucose sa urine. Okay? We also have functional measurement. So under the functional measurement, we do not merely measure no the concentration of the nutrients in those biological specimens, but we actually measure the extent of function. Okay, like for example, immune response for protein status. Because our immune system is heavily dependent with protein, no? That means if deficient ka sa protein, then the immune system would not be able to uh, create like antibodies. Antibodies are made of proteins manggod. So that would mean nga naa kay decrease immune response if ga ka-suffer kag protein deficiency. Okay? So that's why if low ang immune response, then that would indicate that your protein status is poor. Okay? We also have measures of enzymatic activity, like glutathione reductase test for vitamin B2 status and transcatolase test for B1 status. Because these enzymes need these vitamins as their coenzymes. Okay? For example, kaning si glutathione reductase. This is an enzyme that needs vitamin B2 as its coenzyme. Remember what you learned from biochemistry, that there are prosthetic groups in enzymes no, that help them to function. Without them, those enzymes cannot function at all. So, for glutathione reductase, ang iyahang prosthetic group or iyahang coenzyme is vitamin B2. So, that means if dili kaayo if low ang activity sa glutathione reductase, that means low pud ang B2 sa patient, 'di ba? If low ang activity sa transcatolase test, then low pud ang B1. Okay? Because transcatolase needs B1 as its coenzyme. Okay? So, We also have dark adaptation test for vitamin E status. So, mao ni siya ang gi-employ ni ophthalmologist no sa katong case study nato sa chapter 1. Si ophthalmologist nag-conduct siya dark adaptation test para ma-assess ang vitamin A status ni patient. And it was found out nga deficient yun siya sa vitamin A kay she failed the dark adaptation test. Okay, so these are just few of the examples of the functional measurement under the biochemical assessment, because in here we do not just merely measure no the concentration of the nutrients in the blood and other specimens, but here we actually measure the function of those nutrients. Okay, so kani components sa CBC. Okay, example sa components sa CBC. We have the kani hematology, um, complete blood count man. So tanan nga components sa blood kay gina-measure. Like we have the white blood cells, basophils, eosinophils, monocytes, and neutrophils. We also have erythrocytes. We also have the platelets. Okay. And naapod ni siya relevance of course sa nutritional status. For example, if kulang ang RBC, siguro ang patient gay ga-suffer og iron deficiency or folate deficiency or B12 deficiency, because those are the nutrients needed for hematopoiesis or blood cell formation. Okay? Aside from the CBC, okay, naapod tay physical measurement sa blood mismo, specific gravity, ang pH, okay? For example, if ang pH sa blood no is slightly lower than 7.35, then pwede nang ang patient ga-suffer na og metabolic acidosis. If medyo taas sa 7.45, then di na pud na pwede no, kay that means na na alkalosis ang patient. And ang diet sa patient has something to do with the blood pH. Okay? So, I will discuss more about that no when we reach the water nga part. Okay? Bleeding time. Uh, if ang bleeding time is delayed, that would mean nga ang patient kay poor iyang vitamin K status, or basiga kaka-experience siya vitamin K deficiency. Because usually, the bleeding time uh, is just short. But if kuan siya, if delayed siya, no, if moabot siya mga 10 minutes, sobra pa aning 1 to 5 minutes, then that means dili kayo mo clot ang blood, and siguro na is something wrong sa vitamin K, because vitamin K is needed for blood clotting. Okay. So, di ba? We can identify those problems by just, interpreting the results of the biochem assessment. Okay? Hemoglobin. Kung mubo ang hemoglobin, usually iron deficiency, no? Okay? Okay. So, what are the advantages of biochem assessment? Can detect early subclinical status of nutrient deficiency, can identify specific nutrient deficiency, and it is an objective test. Okay. The disadvantages include expensive, invasive, and time-consuming. Okay, kani gyud, invasive siya. Kinahanglan pa mag-draw out og blood, no? Because usually, ang specimen na to is blood, and it's invasive. Okay? Expensive pud siya kay laboratory baya. And a little bit time-consuming. Okay? Standards could vary with wide range. Okay? But, in here, no, naatay mga textbooks nga ato ang i-follow para uniform ato ang standards nga gina-follow. And there may be problems in interpreting results. The significance and accuracy of results of biochemical tests are related to standards of collection, method of transport or storage, and the actual technique used. Okay? Um, Unlike biochemical assessment is objective. Objective means nagamit man gud tag instrument, nagamit tag lab procedures. So therefore, kung unsay result, it's likely more accurate than the subjective, which is antro. Nganong matawag na to nga subjective ang antro? Because especially mag-measure tag height, okay? Ang reader man good is ang individual, no, and um that is more prone to error, okay, especially sa pag-interpret. If dili correct ang pag-measure sa height, then definitely dili pud valid ang result. So that's why ang antro medyo subjective siya, no, compared sa biochem nga objective siya. That's why it's an advantage of the biochemical assessment. And unlike antro, biochem can distinguish a specific nutrient deficiency. So, makabalo siya, no, sa mga specific nutrient deficiencies. Like, for example, if you want to know, no, if naa siya selenium deficiency, for example, then you can just measure the amount of selenium in the blood, or you can measure the enzymatic activity of the enzymes that need selenium as its cofactor. Okay, and can detect early subclinical status of nutrient deficiency. So, while ang antro is long-term, ang biochem is short-term. Okay? If you want to know, no, if na changes sa iyahang nutritional status from the past week, then mag-reflect na siya sa iyang blood. Okay? Sensitive man gud ang blood concentration sa nutrients sa recent changes or short-term changes sa nutritional status. If nagkulang kag vitamin A intake from the past few weeks, then definitely mo reflect na siya sa imuhang blood karon. Okay? So, pila ra na, short term ra na, compared to antro that it could take like months para mo reflect siya sa antro nga 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 part. Okay? Okay. We also have clinical assessment. Okay, that's the third method, no, of assessment. And this is somewhat similar sa antro, but wala taga tanaw, wala taga measure sa dimensions. But in here, we examine the physical features of an individual for signs and symptoms suggestive of nutritional health and or clinical pathology. So clinical examinations are conducted on anatomic changes that can be seen or felt in the superficial. So this is also known as the NFPE, or the nutrition focused physical examination. Okay? So mao nitong akong na-introduce sa chapter 1, no. By just examining the physical features of the person, no, we can infer whether or not these patients have these clinical signs suggestive of nutritional disorders like iron deficiency for koilonychia or spooning of nails. We also have thiamine deficiency for edema, muscle wasting, of course, that's SPAM or protein energy malnutrition, craniotabes, epiphyseal enlargement, bleeding of the rib. Okay, mauning mga possible nutrient deficiencies. Knockness, vitamin D deficiency. We also have hepatomegaly, okay, mental confusion, okay, thiamine deficiency. Okay. So, examples lang ni siya. Of course, it could take like 2 to 3 pages, no? Para naatay complete nga guide for the NFPE. Okay. So, I'll give you a reference on that later on. Okay. Um, but in the hospital, usually ang uh, determine nato through NFP is the level of muscle wasting and subcutaneous fat wasting, especially for those patients who are experiencing weight loss. Okay? Uh, Wasting in temporal, pectoral, deltoid, scapular, dorsal, patellar, and calf regions. These are the parts of the body, no, that would suggest muscle wasting. Okay, because these areas are composed of muscles. Asa maning temporal diri kani. These are the temporal areas, and